Is tinnitus a brain health problem? That is the question we will explore today with Dr. Anusha Yasoda-Mohan, a neuroscientist who is focused on unraveling the mechanism of action for tinnitus. Dr. Anusha, please explain to us your findings and research into the connection between tinnitus and brain health.
Is tinnitus a brain health problem? Is a question that I think we've been trying to answer for the last 40 years. And we have to kind of dial back to when we started to look at tinnitus and where we thought that tinnitus is a sound in the ear. But in the last, I want to say 15 years, we've kind of come to realize that tinnitus is not just an auditory problem. There's problems with sleep, there's problems with attention. People have a really hard time concentrating in their work. They have a hard time engaging in relationships in terms of communicating with others. So, what I found in my research, which is looking at a whole brain approach using what we call EEG or recording brain waves, is that tinnitus is not just lighting up the auditory regions, but it's also activating regions that are extra auditory, which involve other things like attention and sleep and emotions and mood. So we actually don't see this just from, so we see that our story is consistent with what patients report, that the brain is involved as a whole and not just the sound part of it.
And this makes sense because what we see in terms of the causes of tinnitus is that hearing loss is a common cause, but not the only cause of tinnitus. And someone can have essentially no changes to hearing, but all of a sudden develop significant tinnitus. And research has studied, I imagine, different connections between certain symptoms and other networks of the brain. What are the core functions of the brain related to tinnitus?
Attention is one of the most important functions of the brain with tinnitus. We see that there is what is called a top down tinnitus, where there is a connection that's coming from the brain down to the auditory areas, which can be dysfunctional. And we see this essentially in people who don't have hearing loss, but they experience tinnitus. So that's one thing. So attention is one. Stress, big, big, big factor that modifies tinnitus. Everybody can relate to it. We see specific connections in between the regions that are involved in stress and that are involved in tinnitus. Mood, depression, anxiety. We also see the more subcortical regions are more active in tinnitus as well. What is less known and something that we're very interested in is memory. There is not a lot of consensual evidence whether memory is affected because of, is it because of the tinnitus or is it because that we're not able to pay attention? But that's a little bit murky area. But we do see that the parahippocampus, which is a region involved in auditory memory specifically, is one of the generators of tinnitus. So in this way, a lot of the other brain regions are involved.
And in my experience, talking to many patients, being here with the Treble Health community, one thing that is a pain point for us is that so many doctors, ENT physicians, audiologists, primary care physicians are uneducated about tinnitus and this global brain network because they may say, oh, your hearing's fine. Or, yes, you have tinnitus. You just have to get used to it. You just have to live with it, implying that number one, that's easy. And number two, there's nothing else they can do. This is crucial for everyone here to get on the same page that there are things you can do for tinnitus. And I look at it on two sides. One is understanding the causes of why you have this in the first place. What is the mechanism of action? We're going to go deeper into that in our discussion. And the second is a treatment or management plan which is targeted to the causes and the mechanism of action that this individual had. So let's demystify tinnitus. Let's really zoom out and look at all of the potential ways that we can diagnose it and find help for it.
Mhm.
I'll now pass it to you to go further into this subject, please.
From a diagnosis perspective, I think one of the things that we don't do that we probably should do is not just look at auditory frequencies between 125 and 8,000 hertz, which is our standard audiogram. I think looking at the high frequencies is really important because someone can say, oh, your hearing is fine, but it could be that they have high frequency hearing loss. which we know is very common in people with tinnitus. So that's one of the first things that we can start off with. The second thing is
Have you done hearing tests yourself?
oh yeah,
I've been,
oh
in
absolutely, yeah,
the audio booth for many years doing hearing tests, and
absolutely,
the
absolutely.
standard hearing test
Hmm.
is, usually enough for most people, certainly enough for most types of hearing loss, but you're suggesting, "Hey, we're not testing part of the function of the hearing system," and if that part of the test, because there are specific tests that we can measure, if that finds some loss or some change, what would that tell you? How would that help someone?
Then we can actually look at, I think we don't know what to do if they have high frequency hearing loss, if they have, if there's then we don't know actually what to do. There could be, the solution could be hearing aids that are more that are looking at compensating for high frequency hearing loss. So that's one thing that we can start off with, because we know that hearing aids can be a solution for some people. I know people in the tinnitus community in Ireland, there are some people who really benefit from hearing aids that are fit to their tinnitus, that are compensating for the loss around their tinnitus frequencies. So it does help for some people. So I would actually say let's broaden that range. Let's not just look at until 8,000 hertz. Let's look at high frequency and see if we can fit those hearing aids to high frequency hearing loss. That could, as a start, do something for people. The second thing is, if you have high frequency hearing loss, let's say at 10, 12, 15,000 hertz, then prevention, protection could be key, because we know that it's going to start to decline from high frequencies, and that's where it starts. And we also know that it's not frequencies that are very functional in terms of hearing and speech. But if we know that it's starting, then we can take a step back and say, hey, let's prevent. Let's use earplugs when we're going to concerts. Let's find a way to muffle out the noise, or let's look at more let's invest in some good hearing equipment in terms of entertainment. It doesn't mean that we have to stop listening to music over headphones. So that's the other thing that we can do.
What we're really looking at here is to understand the tinnitus brain health problem. We have to be very clear on how much of the ear is responsible for tinnitus. We can measure the ability to hear with a hearing test. There are more specific hearing tests like high pitch or high frequency hearing tests and otoacoustic emissions. Those are very specific tests. If anything, they give us knowledge on how much of the hearing organ cells are involved potentially. That said, someone can have a significant hearing loss, but the actual reason why their tinnitus has gone from low, mild to severe could be something completely unrelated. So, in some ways, a hearing test that shows, oh, you have a mild hearing loss, or yes, your hearing test showed you have a high pitch hearing loss, it can be a sort of false signal, and it can make you believe, or someone might tell you that your tinnitus is caused because of your hearing loss. But if we think about this further, logically, that hearing loss was either already there or progressively changing very slowly over the years. But this individual experienced relatively quick changes and an increase in loudness to their tinnitus. So there's usually something more than just the hearing loss. And let's go into this something more, right? The tinnitus being a brain health problem potentially implies that there's other important areas that something has gone wrong, something is abnormal. Let's dive into the research there, and your impressions there on stress, anxiety, mental health, and how that can trigger tinnitus or potentially sustain the loudness of it.
Hmm. So, like, absolutely, like you said, some person can have hearing loss but not tinnitus, but and someone can also have no hearing loss but tinnitus. And I think the stress plays a major role. A lot of the people in our community have said that I have stress induced tinnitus, in fact. So for me, when I have tinnitus, I have high frequency tinnitus in my right ear when I feel extremely stressed. So at that time, I take a step back. I manage my stress. So, a couple of ways I manage my stress is deep breathing. We know that there is literature right now that is showing the role of breathing, and how breathing can actually modulate certain regions in the brain. and which are directly connected to some of these regions that are both involved in tinnitus and involved in stress as well. So, in that sense, you get a more what we call top down modulation of your tinnitus by actively engaging in changing your stress levels. That can look differently for different people. For me, it's breathing. I even sometimes just go to sleep, take a nap. That works for me as well. For some people, it can be listening to calming music. Some people, it can be going for a walk. So, stress management can look differently for different people. So, that's one thing that we can do.
I'll say this point blank that, in my opinion, stress can be the cause of someone's tinnitus
Hmm.
increase. It's something that most doctors wouldn't diagnose. It's something that most doctors would say, I don't know what caused this. But those of us who are specialized in this field can say, through a diagnosis of exclusion, we've ruled out hearing loss, we've ruled out jaw TMJ, neck issues, we've ruled out medication changes. Therefore, the most likely culprit for the cause of your tinnitus is, in some cases, stress, right?
Absolutely. Stress can also look like, losing a job. It can look like losing a member of the family, so grieving. It can also look like just work stress, just having a stressful job at work. So a paper by my colleague Sven Vanesta in cerebral cortex, actually shows this actual connection. So there's a functional connection between the regions that encode stress and the loudness components. And you see that in people who are highly distressed with their tinnitus actually show an increased connectivity between these regions. So there's more exchange of information between loudness and stress in people who are very stressed by it. So, yes, in that sense, it's also an internal learning process that, okay, so I'm associating the sound with the stress, and the brain sort of learns it as well. So now it becomes the new norm for the brain to associate the sound that they're hearing with the stress. So that's also one of the reasons why it's harder to modify it.
One of the most useful counseling tips and perspective changes that I ever heard in the tinnitus world was that for most people, tinnitus is neurological in origin, meaning that nothing is permanently broken here. And even though someone can be weeks, months, or even over a year with this unwanted, disturbing noise, that due to the brain's plasticity ability to change, that we can resolve the issue to a significant degree. It may not be completely back to where it was before, but 70%, 80% type improvement is seen every day in terms of, tinnitus specialists like me and our audiology team. So that message is so important. Someone may hear, okay, well, if stress caused my tinnitus, I'm not going to live a life without stress. Therefore, am I stuck with this? And the answer there is no. You, through methods, through certain programs, through therapy options, through treatment options, someone can reduce this to a very real degree. And that's the message that we wish most doctors would share to their patients when they first visit the clinic. That said, let's touch on sleep, exercise, and diet. Let's start with sleep.
Hmm. So, sleep is one of the most understudied things in tinnitus research, but it's a very, very real problem. And there's a paper that came out very recently, a very nice review paper. And there's also a video abstract, and I can share the link of the paper with you so that the viewers can actually hear the abstract of the paper, where it's saying how these regions that we've talked about, which are involved in mood, which are involved in tinnitus, are actually affected by sleep. And now there's a big increase in the number of studies that are looking at non-REM sleep. So one where we're not dreaming, and one where the period of sleep where we're there most where we're sleeping most of the time are actually regions that are involved in tinnitus as well. So many people have asked me, so what can I do to sleep better? One, stress also impacts sleep. So managing stress can also directly impact sleep. So that's one thing. And number two, people use different things. Noise maskers sometimes help them go back to sleep. We also see that people don't really have issue falling asleep, but once they're up, they can't go back to sleep again. So trying to listen to calming music, using noise maskers, trying to get back to sleep can really help with the tinnitus the next day.
And what has research found in terms of exercise and diet and its ability to regulate the central nervous system and promote brain health, which could lead to improvements with tinnitus perception as well?
So, exercise is an interesting topic because there's two different types of exercises, and I'm sure everybody know there's low intensity, there's high intensity, and we all know the effect of exercise on heart health. There is some discussion as to whether high intensity or low intensity exercises, who should be doing this, because exercise regulates stress levels and cortisol levels in the brain. But one thing what's very interesting is that exercise that invokes a mind body connection, which we've seen in yoga, tai chi, things like this can actually regulate not just the heart health part of it and actually improve their actually exercise actually improves volumes of certain regions in the brain, especially regions that are associated with mood, but it can also provide a holistic connection with the mind and the body. So that way you improve mood and at the same time you improve your physical body as well. So that can, we don't have any evidence in tinnitus, but borrowing from other literature, I think we can say that a mind body connection exercise could help with tinnitus.
So far from our discussion, it seems that tinnitus could be a brain health problem for some individuals, but not always. To understand the true mechanism of how does tinnitus start, for me, we've talked about hearing tests. We've talked about these other factors that could lead to tinnitus, like stress on the nervous system, stress in my everyday life. I touched on potential medication changes. There's other causes. I want to hear from your perspective, Dr. Anusha, what is the mechanism of action for tinnitus? Uh, what do most people misunderstand about why tinnitus begins, and what is the cause of it?
I think most people think that some sort of hearing damage is necessary for tinnitus to occur, which is not always the case. And tinnitus can start from changes in certain brain structures. It can start from, you can have perfect hearing, but that doesn't mean that tinnitus cannot be caused. And I think one of the main causes for tinnitus, generators for tinnitus, is stress and how the brain is not able to compensate. In some ways, tinnitus is a compensation mechanism for the brain for something. That something can be different for different people.
I have a great analogy for this. I think of I'm preparing to make some tea, and I have a teapot on the stove, and there's a flame under the stove, and that flame is building a lot of heat and pressure in this teapot, in this tea kettle. At some point, the tea kettle has a compensation mechanism, which is that when there's enough pressure, when there's enough heat in the system, it opens and it whistles, right? So that whistling sound, it's a great analogy for this because when the brain and the nervous system has so much pressure on it through periods of stress, that tinnitus can be an effect of the brain, an effect of the nervous system, and it is a high pitched sound, not too different from a whistle. What is really happening here? You're a
Oh
neuroscientist.
my
Help me
God.
understand this.
Oh my God. I think that's I mean, I don't think there's anything more I can add to it, Ben. I think that's a brilliant analogy, and that's exactly what's happening. So all that pressure, however you want to put it, on the brain is can regulate these regions that can create changes in brain waves, can create changes in structure, can create changes in the way different brain regions talk to each other. And yeah, we don't really see it from causational standpoint. Like we do see it. So we actually did a study in our lab where we induced a very short hallucination or an illusion of a whistling, and we actually saw that these regions that are involved in chronic tinnitus also showed up in the people who were able to perceive that illusion or perceive that short burst or short whistle. So yeah, in that sense, well, it was not, we were not putting pressure on them, but we were creating some sort of a decrease in input that was going in the brain. So we saw that the brain was compensating for what it was not hearing. That's one way to look at it. We did another study where we had people look at a checkerboard, while we also presented a auditory stimulus. So they were saying, okay, yes, I can see this, no, I can't see this, yes, I can see this, no, I can't see this. So it's like a conditioning, like the dog salivating when it sees a whistle, so when it hears a bell. So what we saw that where some people are more sensitive and they actually think that they hear something when something's not there. So this is another way of generating phantom percept, where you change, where some people are more likely to learn that association. So you see both ways. So you see the bottom up that's coming from the lack of input, and you also see the top down where it's the way people learn environments as well. So you see both mechanisms that are involved in generating phantom perceptions, auditory perceptions, which could happen in tinnitus as well.
One thing that's very important is for us to always keep our core mission, our North Star, close to our work. For you, you've chosen to research in tinnitus. For me, we've chosen to provide telehealth services to those with tinnitus. Our North Star, our mission is to provide an accessible and comprehensive treatment to people with tinnitus. What are you hoping to achieve with your research in the next years to come?
I think tinnitus is a brain health problem is a very hopeful narrative. It doesn't get said enough, but it's a very hopeful narrative because it gives us ways and it gives us avenues to actually explore ways of compensating for tinnitus, which is not just auditory. Oh, I'm hearing aids doesn't work. It doesn't mean it's the end of the world. Or anything auditory doesn't work. It doesn't mean it's the end of the world. So what I want to do is actually say that, hey, listen, it's not tinnitus is not just auditory. There are other things that impact brain health, that there are stress management techniques, there are anxiety management techniques, there are ways of improving the intake, like what we eat. There's a direct connection between the gut and the brain. There are several papers that talk about connection between the gut and the brain. These are actually important. These are other ways which can impact brain health, by which we can impact these top down pathways that regulate tinnitus. And that's what my research will be. And I want to convey that hopeful narrative to people, that it's not hopeless. It's not that you can't do anything. There are things we can do. There's just no research to back it up, but you can try it at home and you can be your own researcher.
Great. Well, there is certainly research that we use in our everyday practice with thousands of patients, and those methods have been studied to provide the today's most up to date treatment for tinnitus. Another useful analogy that helps a lot of patients in our community is to think of our stress or our nervous system as a battery or a bank account. Right? We can have be completely empty, low battery or no battery left, or we can be fully charged. Our bank account can be totally empty or rich with monies, let's say. So using the battery analogy, if the battery is completely low, then tinnitus is going to feel more intense, more intrusive, harder to manage. I'm going to feel more anxiety, more overwhelm, more stress. This applies to other parts of life as well. This is not just tinnitus, right? So if my battery is full, then I'm able to put tinnitus in perspective, keep it in the background of my mind, be proactive with my daily activities so that the tinnitus sound isn't dominating and I can live a full and productive life. So the secret there, or the question, is what are the evidence-based methods to fill up my battery and provide myself a healthy brain, a healthy nervous system, healthy habits that support my recovery? We've talked about this a bit. Would you like to expand more on what today's leading research shows in terms of healthy brain, healthy nervous system?
Absolutely. So, in terms of healthy brain, healthy nervous system, we actually have this is the tagline of one of the biscuit companies in India. And I grew up seeing this was eat healthy, think better. It was such a simple line, but it says so much as to how diet is important in thinking better and having a healthy brain. So, I think food is the first thing. know what you're eating and mind what you're eating, be mindful. I think the key to all of this is awareness and knowing when things are getting hard for us. I'd like to add to Ben's session of analogies that tinnitus, someone once told me this analogy. This is not my own, so I'm going to borrow from a friend, that tinnitus is like a check engine sign on the car, that it's something that goes off. So it's not that we know that when the check engine sign is off, we know that we have to check the engine, not the light. So tinnitus could be a check engine sign where maybe it's indicating to us that there's another part of our life that needs attention. And what that part of our life that needs attention is different for different people. And only that person knows what they have to pay attention to.
And with that, for those hearing this and thinking, that sounds great, Dr. Anusha, but I don't know, it sounds too simple. Is a there are many nuances to this. Someone could have jaw or neck condition, and a lot of this doesn't apply to you actually. Tinnitus isn't really a brain health problem if it's caused by your TMJ or temporomandibular joint, for example. If you had a medication change and that caused your tinnitus, well, sort of related to your brain, but that's not the root cause or necessarily the pathway for how to get the quickest relief. So definitely speak to a professional, Treble Health, others, local tinnitus specialists, because diagnosing the actual root cause in your case leads us to the fastest and most effective treatment out there. However, for a lot of people, this global brain network and tinnitus being a brain health problem is very relevant. And understanding this is one thing, implementing it is another. You can learn about doing push-ups, but if you don't do them, if you don't put things into practice, you're not going to be healthier. I want to address something that I've seen in the online tinnitus world, which is some misinformation about tinnitus and its potential link to memory, cognitive decline, dementia. Can you set the record straight here? What is the current relationship between tinnitus and having a risk of cognitive decline or dementia?
I want to be very clear about this. There is no research that shows a direct relationship between tinnitus and cognitive decline and dementia. So, what we know until now is that tinnitus and dementia share some common denomination factors like hearing loss and stress. But whether tinnitus causes dementia, there's no research that shows that it's causal.
And when there's no research, we should not speculate that, oh, well, they haven't disproven it. No, that's not how this works. You have to prove that the link is there in order to believe. Otherwise, that's just not the right way to think about this. So my initial thought is someone hearing this might think, oh, but they haven't disproven it in the scientific labs. Don't think like that in this domain because it's really not serving you. And there's nothing that we're seeing in the research scientific world to suggest tinnitus causes cognitive decline or you have a higher risk of it when you have the sound.
I think as a researcher, I also have the responsibility to say, we don't know. We don't know this. And this is not, as of today, we don't know. And if there is something, then we will figure it out. That's what our job is.
And on that same note, research has found that hearing loss can lead to social isolation on average, and social isolation, not using our brain, leads to negative brain changes, right? That's a very logical connection. So, in that sense, research is studying hearing loss and cognitive decline, risk of dementia. However, we do not just say if you have tinnitus, therefore you fall into this same potential relationship with those who have hearing loss. It's really not like that. So there is that potential link. Those who have hearing loss should get it treated, should consider various options with hearing treatment, etc. But I'm glad we set the record straight there. And yes, like you said, we don't really know. It hasn't been fully studied and tested, but hopefully we can disprove that over time. And as we get more advanced with brain imaging and tinnitus, etc., we'll have more resources for that.
Yeah, I think it's important to know that anybody who is stating something causal, if someone is saying this causes this, please talk to a professional and figure out if that's true. Because there are a lot of people out there who want to sell products and who say a lot of things that are causational. So, one of the first things that we learn as a researcher is what is correlational, where there's a relationship, it doesn't always mean that one causes the other. So that's one of the biggest gems of research that is helpful in trying to understand what treatments work. So unless and until talk to a professional, they know how to evaluate research. And there are some gold standard research designs that show that there are certain treatments that work. So if it's not a gold standard treatment, I don't want to also say that what works for you and keep doing what works for you. But if there's a strong causational relationship before going further into that, just talk to someone who knows, who can explain the science behind it.
Dr. Anusha, thank you so much. Let's end with you sharing some creative solutions to manage tinnitus and empowering people with a message of hope and positivity.
One of the things that I want to say is engage in things that enrich your experience and enrich your life. Talk to people, hang out with people. We also see in our tinnitus community in Ireland that people tend to isolate themselves a lot. So please don't isolate yourself. Talk to people. And I am actually going to take this opportunity to say that engage in something creative, stimulate your brain. Creativity, arts is a great way to stimulate your brain. And there's a lot of research that's coming out now, which talks about engaging in the creative arts, increasing brain plasticity. So much research. So engage in something that enriches you, that's soulful, that connects with your soul, that connects your mind and your body. And it's definitely a way to increase or improve your brain health. And as a researcher, I'm going to tread the lines and say I don't have data to show you that it works for tinnitus, but that is my goal in life to actually show how the creative arts can be a creative avenue for tinnitus as well.
Dr. Anusha Yasoda-Mohan, neuroscientist, thank you for sharing your work focused on tinnitus. My name is Dr. Ben Thompson, audiologist with Treble Health. We'll talk to you soon.